Okay, so welcome to the second session in this Q&A. So in this section we're going to talk about post-traumatic stress more specifically. So there was quite a few questions that are really asked about what post-traumatic stress disorder is, and also about treatments and how you can be supported through that. So in terms of PTSD, what is it? Well, post-traumatic stress disorder is an emotional and behavioural response to a traumatic event, and it can show up in different forms, and it can look different based on the ages. So quite commonly you can have sleep disturbances, problems with sleeping, having recurring thoughts or nightmares about the event or situations related to the trauma, irritability, anger, aggression, depression or anxiety, which is quite general, but also hyper alertness, so hyper vigilance, and really getting quite worried, in particular around situations or information that's related to the traumatic event, whatever that traumatic event is. In younger children, it can be, increased temper tantrums, increased challenging behaviours, and it can vary from child to child and from person to person in terms of how it manifests, but really what it is simply a behavioural and emotional response specifically related to the trauma. Now, in terms of PTSD, research in PTSD, I just want to be clear that it's a really wide area of research, and there's lots of different reasons for people to experience trauma. So it can be a traumatic event such as a car accident or something quite sudden where there's the potential where you might have lost your life, or someone close to you might have lost your life. There's the trauma that's associated with abuse. So if you've been exposed to physical violence or sexual violence, that can also trigger post-traumatic stress. And there's another area of the literature which is more relevant to what I'm talking about, and that's related to medical traumatic stress. So medical traumatic stress is a thing. It's trauma that and traumatic reactions that are really associated with or related to a diagnosis, an illness, and it can be your own illness or the illness of your child. So can you avoid PTSD or prepare for it? And I don't think you can necessarily avoid PTSD because we don't necessarily know when a particular traumatic event might be occurring to us, so we can't necessarily prepare or avoid for it. I suppose the most that we can do to prepare for it is quite general advice, is to just make sure that you're always well supported, that you've got someone to talk to, that you maintain your own resilience. So you engage in behaviours and you do things to generally make you feel good, and those kinds of resilience strategies are one way to, I suppose, reduce your potential risk of developing PTSD. But then there's no evidence to suggest that will completely prevent you from developing any of those symptoms. So I haven't got a better answer for you with regards to that question, unfortunately. If you suspect you have PTSD, who should you talk to about it, and how can you best support people that have got it? The first people to speak to about it is loved ones, close ones. Get as much support as you can. Sometimes they can just be transient symptoms that last for a short period, and getting really good family support from family and friends for some people is all that's needed. having people to talk to. But if you find that it's quite extreme and having a big impact on how you're feeling and how you're functioning, and it's continuing on for more than a couple of weeks, then perhaps think about talking to a psychologist or a therapy or your GP, just to see whether what you're experiencing is a normal part of the adjustment process, or whether there might be something a little bit more serious where you might need to get some support from a professional. How you can best support your child is, number one, is to understand that maybe some of the difficult behaviours or any change of behaviours might be due to them experience a traumatic event, experiencing something in a hospital that maybe was really difficult for them and difficult for you. So understanding that any changes of behaviour might be due to that, and also keeping those open lines of communication with your child. And again, if you're feeling like it's getting to a point where it's really affecting their functioning and their mental health, then certainly go and see your GP and seek out the help of a psychologist that's really got specific expertise in managing post-traumatic stress. Are certain people more at risk of developing PTSD? So this is a really tricky question, and it's a tricky question because, again, there's different reasons for developing PTSD. So what I might focus on is thinking about the research that's really looking at medical traumatic stress, and what the research is showing, and our research is also showing as well, is there are certain psychosocial factors that can really contribute to or give you a greater risk of developing PTSD later on. So that could be things like pre-existing mental health issues. It can be the amount of social support that you've got around the time of the trauma, and it can be things like your initial emotional reaction to the trauma, and what your thoughts are around the trauma, and your belief systems about what the trauma means for you and for your child, and what that means for all of you and your family down the track in the future. So thoughts around the impact of the trauma can also increase the risks of post-traumatic stress. Having said that, it is all statistical, and again, each person is different, each family is different. So just because you may have those risk factors or may not have those risk factors doesn't necessarily mean one way or another that you'll get symptoms of PTSD or not. This is a really great question. Why is that when you think you're finally okay, suddenly you're filled with fear, anxiety, or just feel upset about your child's heart condition and what they've been through or what might be ahead of them? I don't understand why it happens at times when I'm not expecting it. It's a really great question, and it's something that we noticed as we went through the program and spoke with parents through the program, is that it's a really common occurrence, in that sometimes you can feel like you've had an early distress reaction, or you haven't had any reaction, and it can be a few months or even a year or years down the track, and things seem to be going okay, and then sometimes there's a particular trigger that brings up all of the thoughts, all the feelings, all the emotions that you felt or you experienced during the acute stages of the illness. One example that frequently came up was that parents would often say that even many months or even years after their child has recovered, in that sometimes they would still smell the scent of the hand lotion that's in the hospital, the disinfectant, the antibacterial lotion. Sometimes they would be at home or out somewhere else, and that smell would hit them, and that would trigger them and remind them of what it was like in those early days. All the distress, all the fear, all the worry came back, all the thoughts, distressing thoughts came back in terms of what they were worried about, and what they were really fearful of in those early stages when things were really uncertain. So that's a really normal reaction, a really common reaction, and unfortunately there's nothing that I feel there's nothing that we can do to completely eliminate those triggers. Having greater awareness of them can help you to better manage your response and your reaction to them, but there might be some situation or some event or some phrase that might come up at a totally unexpected and unrelated time that can remind you of what it was like being in that hospital, or what it was like not knowing whether your child was going to survive or not, and all of those feelings and experiences come back even though you're not in that place anymore. So I don't feel that there's anything that can be done to prevent those triggers necessarily, but mindfulness, and we're going to talk about mindfulness next, can be a really great tool, a really great skill to develop, just to build that extra awareness. So you're more aware of what you're experiencing internally, you're more aware of thoughts that are coming up, you're more aware of feelings that are coming up and how they're affecting your how you're experiencing your life at this present moment, and also how that might impact on how you're talking to or relating to people. So how you're talking to and responding to your partner or your children might be affected if you are reliving or re-experiencing those thoughts and feelings. So mindfulness can really support in developing a greater awareness. And if there's any other questions around that, I'm happy for people to ask. Send me an email. There's another mother, I won't name her. She said that she did suffer from depression and anxiety and had many panic attacks, and said that she found pure therapeutic ketones, which I suppose are like vitamins. And she asked whether any research has been done or is being done. And she also said that since taking the ketones, she's had no panic attacks and is weaning off all of her mental health medications, which is really fantastic news. It's certainly nothing that I don't really know much about that, the therapeutic ketones, and I don't know any of the research in that space. But perhaps that might be something that Rachel can look into for a future Q&A with perhaps a nutritionist or a dietitian to talk about the research in that area and the benefits to your mental health. What I would like to say is two things. Is one, if it's working and if it's helping you, then there's no reason to stop doing it if you're feeling good. The other thing is that all of these different ideas and approaches and therapies, they don't work for everyone. If there was a single therapy or treatment that worked for everyone, the inventor of that product would be a very rich person. The idea is to find something that works for you, try different approaches, therapeutic approaches, and see what benefits you, but always do it in a safe way and in conjunction and under supervision with medical supervision. So that's what we've got in the PTSD section. I'm going to talk a little bit about mindfulness in the third segment.